You, Chairman. Happy to see that we are dialing back on the requirements that school-age kids have to be vaccinated in order to get in-school education. The conversation evolved from mandatory vaccines that hope to stop a person from receiving or passing the virus to mandatory vaccines to keep people from dying. To this virus, I'm sorry. The conversation have evolved from mandatory vaccines to hope to stop a person from receiving and passing the virus to mandatory vaccinations to keep people from dying, to the virus having a new strain, to a booster, to another booster, and to a new booster just 2 weeks ago. Was a new phenomenon for us all, and we all had to figure it out while being smack dab in a crisis. The government, I believe, overstepped its boundaries, circumventing parental approval to vaccinate children. I think that need to be dialed back as well. The CDC has not recommended we require students to be vaccinated to go to school. And so although we're pushing it to next year, I think this is the beginning of a start of evolving as we grow as a council and learn more of the effects and the evolution of this virus. Thank you.
Thank you, Councilmember. Further discussion? Councilmember Henderson, do you mind if I speak for a moment?
As Mr. Chairman, please note that Councilmember Silverman wishes to be recognized as well.
All right, Councilmember Silverman, and then me, and then Councilmember Henderson.
Thank you, Mr. Chairman. In listening to the conversation right now and at the breakfast meeting, this is a difficult vote because we all agree on this dais that the COVID vaccine is safe and effective. We want all of our residents who can be vaccinated and boosted to do so for their own health, for the health and welfare of their families, and for our health as a city, as I think Councilmember Pinto mentioned. But the reality is there are still many residents who are not vaccinated, and many of those residents are school-age children. In the breakfast meeting, a number was cited that there are 23,000 school-age children not vaccinated. If I'm not mistaken, that would be 1 out of 4 of our public school students about. And that's what makes this difficult. I don't want to put a policy in place that's going to keep those kids from school right now. I think it was said before by another colleague, but we need to move the needle on getting these kids vaccinated, whether it be continuing to persuade parents the vaccine is safe, or I think this was suggested in the breakfast meeting, again, setting up mobile clinics at schools to make the vaccine as easily accessible as possible, whatever it takes. I'm also a reluctant yes today, because I want kids in school, but we also need to move the needle on increasing the vaccination rate during this delayed implementation. Thank you. I know Councilmember Henderson and Mr. Chairman, you put a lot of thought into this, so I thank you both.
Thank you, Councilmember Silverman. Councilmember Allen.
Thanks, Mr. Chairman. I'll kind of echo a couple of sentiments here that I've heard, which is this is a really tough vote. As I have weighed this and talked with lots of parents around what they think and their concerns and their continued fears around the spread of COVID, this vote seems to really try to come down to we're being asked to make a choice between 2 harms. And trying to be, to some degree, realistically weighing which harm is an acceptable harm, which is an incredibly difficult thing for us to have to think through. And I hope it's stated strongly and unequivocally that we want children vaccinated. Vaccines work, they are safe, they are effective, and we need to have every child be vaccinated. And then we're also faced with the reality that tens of thousands of students would not be able to be in school and in class, and seeing the reality of the stark and steep impact that has on those students in school, and beyond just the academics, everything else in that student's life. The resources, the connections, the supports. This is a tough one, but I am going to support this today. Not because I don't believe that every single kid needs to be vaccinated, but because I believe the harm of having that many kids pulled out of our school system would be incredibly detrimental. And it is just a very difficult vote to cast to try to figure out between two different harms, which one will we go with today. So I hope everyone understands the wrestling that many of us are feeling around this, but the recognition of it moving forward. Thank you, Mr. Chair.
Thank you, Councilmember. Councilmember Che.
Thank you, Mr. Chairman. And Councilmember Allen has it just right. We're being asked to weigh two things, and it's very difficult. Although I do want to say that perhaps one of the reasons why many thousands of children have not been vaccinated is because we have signaled that we are not going to take seriously requiring the vaccinations. We haven't tried efforts like having, as I said this morning, pop-up vaccination clinics right around schools, so that students who are otherwise not vaccinated could get vaccinated right then and there and go walk right through the schoolhouse door. We are sending a very, very bad signal here, and we have created this difficult choice, these two binary outcomes, and it's hard to determine which is worse. This is extremely difficult and hard to measure. You like to think that, well, at the end of the day, if you think hard enough about it, you'll know where you're going to come out. And it's still, for me, indeterminate. So I may just vote present because I can't pick my poison here. Thank you, Mr. Chairman.
Thank you, Councilmember Che. Councilmember Bonds.
Yes, thank you, Chairman. I will be supporting today's legislation with the hope that we will put in place a plan such as that proposed by Councilmember Shea, where while we are going to delay it, we also can make sure that immunization can come to the schools where the kids are. Thank you, Chairman.
Thank you, Councilmember Bonds. I'm going to say a couple of things. First of all, it's not correct to say that we haven't tried. The Committee of the Whole had a hearing on October 11th. There was testimony from a number of public witnesses and then representatives from the Department of Health, DC Public Schools, OSSI, the Charter School Board, and the Deputy Mayor for Education. And what was said at that hearing is that the executive agencies have actually tried very hard and done a lot with regard to expanding access to vaccines. I mean, incredibly. They had personnel stationed in many of the schools. They had mobile clinics. They had multiple sites where people could go. The cost of getting vaccination was eliminated. They tried in so many different ways. There wasn't a question that came out of the hearing whether the executive was trying. But in my view, this legislation, and I support this legislation, I'd better since I'm co-moving it with Councilmember Henderson, is not because, for me, it's not because the take-up rate with COVID vaccine is lower than with the other vaccines. It's because I think it is time to question whether we should have a mandate in place for this vaccine. Now, this bill doesn't eliminate the mandate. It simply puts it off for a year, which gives us time to look at this more. I want to say this. This council has been very good about adhering to the science for, 3 years now, 2.5 years now. Over and over again, we have seen the country rife with controversy over whether to wear masks and whether to shut down and whether to reopen. And all along, we've been following the science. And a year ago, the science was pretty clear. Not enough people were getting vaccinated. People should get vaccinated. The Omicron or the Delta, I can't remember which variant, was on the verge of surging, and we thought it was going to be more lethal. Not only were we focused on mandating vaccines, but we were very concerned that we were just going to see this pandemic get worse and continue. That's where we were a year ago. And Councilmember Henderson came forward with legislation to impose a mandate. This looked like something that was going to be picked up around the country, right around the time California, the state of California, adopted a mandate statewide. We seem to be very much in step and following the science. A year later, where is the science? I just now checked the CDC website. It does not say schools should mandate the COVID vaccine. It does not say that. The science does not say the mandate is what they recommend. In addition, what we're seeing is that some of the jurisdictions that had it, Councilmember Henderson, I believe you said this morning, California has postponed the mandate. What we're seeing is that the pandemic is evolving into more of an endemic, and so it's a different situation. But this legislation doesn't say kill the mandate. And as, again, I repeat, this is not in my view, oh, the take-up rate is low and therefore, no, it's what does the science say? And the science, if anything, suggests that maybe we should think about this more. And I've said that we will have a hearing in the spring to look at this. And so I think it's completely appropriate to move forward with this legislation that with regard to the COVID vaccine says, let's wait till next school year and sort this out a bit more and understand the science and understand where the COVID virus is going. So that's why I'm supporting this. For Councilmember Henderson, you were next.
Thank you, Mr. Chairman. I just wanted to address something that both Councilmember Bonds and Councilmember Che brought up in terms of the number of clinics and appointments that were made available. But I did have a conversation both with Dr. Farley at the hearing and then Dr. Lewis at the head of, or the interim or acting head of DC Health. Because I said something similar, Councilmember Che, of like, if we know that X number of students are all missing the same vaccine, why can't we just bring the vaccine to them, have their parents sign a permission slip and just do it? And unfortunately, health insurance gets involved outside of COVID when you're talking about other immunizations. And then they also brought up some other logistical challenges with that. But I know it's hard for us to remember back to a year ago, but we gave out AirPods, we gave out gift cards, we gave out college scholarships. I think we've done a lot on our front. We've had mobile clinics and have really, I think, stepped up our work with community-based organizations to increase public health awareness around the importance and efficacy of vaccines. Prior to this meeting, I circulated amongst the colleagues the latest reporting from the Back to School Safely Reporting Emergency Act, I think that Councilmember Lewis George introduced, where we are required, or where DC Health and OSSI are required to send us bi-weekly updates on the numbers of compliance. And I just want to say where we are as of October 24th for the record. And I'll just give you a couple of LEA examples as opposed to bringing up specific schools. So for routine pediatric immunizations, the non-compliance rate for DCPS right now is 23%. Now, I know that seems high, but I think people need to also keep in mind that we haven't started the enforcement for middle and high school grades yet. In contrast, the non-compliant rate for DCPS for the COVID vaccine is 44%. Another LEA that has multiple campuses, Friendship Public Charter School, the non-compliant rate for routine pediatric vaccines is 22%, whereas the non-compliance rate for COVID is 60%. So we have students who, and their families who are choosing to get vaccinated in terms of the routine pediatric vaccines, but are making a different choice in terms of COVID. And I think this data kind of bears that out a little bit more. Thank you, Mr. Chairman.
Thank you,
Can I ask a
Councilmember.
follow-up question about this?
Councilmember Che.
Councilmember Henderson, you're saying things were done, the chairman said things were done, but you also started to identify maybe what the obstacles are. If it's insurance or money, we can take care of that. If it's ready access, or more frequent access to COVID vaccines, we can take care of that. But I fear that it's simple unwillingness based upon stuff that goes out there in the ether about whether this is safe and all the rest of that. The anti-vaxxers are having, they're having their day on this. And I think that we add to that by saying, I know you're saying, the chairman's saying that we're just postponing it, but we're on our way to saying we're not going to require it. Well, the same is true of other vaccinations. People may have qualms, but do they have a right to subject other people to illness, whether it be teachers or staff or other children? It seems to me that if COVID is still a serious problem, maybe we don't think it is, but if it is, then it seems to me we ought to take steps just like we do with other serious transmissible disease and require vaccination. And if there are these obstacles, we can overcome them. I'm not sure, which is why I have this hesitancy, I'm just not sure that we've taken all the steps we can, like, for example, paying for the vaccine or what have you, to get people to comply. And we're encouraging them now not to comply. Thank you.
I'm going to jump in here and read from the Department of Health's testimony. The first strategy was to ensure immunization access to all families across the district. There are now more than 50 standing clinic locations in the District of Columbia where families can access routine pediatric immunizations for their children. We worked with our partners to hold 37 mobile clinics, mostly at schools, and 25 vaccine exchange clinics. We also opened the doors of 7 school-based health clinics to all children through September. Starting in August, DC Health worked with Children's National, Unity, and Mary Center to begin holding weekly special vaccination-only clinics for families that were unable to schedule routine well-child exams in time for the start of the school year. Beginning last week, Children's National opened high-volume vaccination opportunities at 5 clinics across the district. These clinics are open from Monday through Friday, as well as weekend and evening hours, to accommodate families who may not be free during traditional hours. This week, we announced an additional partnership with Safeway to offer high-volume vaccination-only clinics during the week that pre-K through grade 5 students are scheduled to be excluded from school due to non-compliance with immunization requirements. And it goes on for another page or two if you want me to read it, but the point is that they actually have done a lot to increase access. Councilmember Pinto?
Thank you, Mr. Chairman. And I would agree that the city has done a lot to increase access, and some of the examples that Councilmember Henderson cited around scholarships and iPads and gift certificates, I think played a big role in that. And I also think vaccine requirements played a big role in that. And as Councilmember Lewis George mentioned, when we looked at across other categories, the weekend or week before enforcement was set to start, then numbers really went up. And so we know this can be effective. We still have a couple of months before compliance. I want to just lastly read from the CDC website, since we're citing different recommendations. This is in response to the question, should parents and caregivers wait for updated or additional vaccinations, even if a child's risk of infection is low? And the CDC says, parents and caregivers should get their child vaccinated as soon as vaccines are available to them. Getting vaccinated provides the best protection against serious illness if a child gets infected with the virus that causes COVID-19. Since there is no way to tell in advance how children who are not moderately or severely immunocompromised, or those who may be, a child can be immunocompromised and still healthy, will be affected by COVID-19, and it's important to get them vaccinated as soon as possible to protect them from severe illness. So just wanted to add that to this discussion, because it seems like a lot of people are saying we still think the COVID-19 vaccines are safe, and I would just say we're only on November 1st. We have a little bit of time, and let's try to use this tool to get as many folks vaccinated as possible, especially our kids, to keep them safe and our teachers safe.
If there's no further discussion, we'll have a roll call vote on the declaration. The roll call is on PR 24-1022. Madam Secretary?
Chairman Mendelson.
Yes.
Chairman Mendelson votes yes. Councilmember Nadeau.
Yes.
Councilmember Nadeau votes yes. Councilmember Pinto.
No.
Councilmember Pinto votes no. Councilmember Silverman?
Yes.
Councilmember Silverman votes yes. Councilmember Robert White?
Yes.
Councilmember Robert White votes yes. Councilmember Trayon White?
Yes.
Councilmember Trayon White votes yes. Councilmember Allen?
Yes.
Councilmember Allen votes yes. Councilmember Bonds?
Yes.
Councilmember Bonds votes yes. Councilmember Che?
Present.
Councilmember Che will be recorded as present. Councilmember Gray is absent. Councilmember Henderson?
Yes.
Councilmember Henderson votes yes. Councilmember Louis George?
Yes.
Councilmember Louis George votes yes. And Councilmember McDuffie?
Yes.
Councilmember McDuffie votes yes. Mr. Chairman, there are 10 yeses, 1 no, 1 present, and 1 absent.
The declaration is approved. On the underlying bill, Bill 24-1069, Councilmember Henderson.
So moved, Mr. Chairman, but at this time, I would also like to move an amendment in the nature of a substitute, which had been circulated.
Okay.
Can I
proceed.
speak to explain? Upon reviewing the bill, the General Counsel recommended some changes to the emergency and temporary bills, some of which were technical that corrected some drafting errors, but it doesn't change the underlying impact. Thank you.
We have the amendment nature of a substitute before us. If there's no objection, we will treat it as accepted without objection. Is there any objection? Hearing none, it's accepted. We have the bill as amended. Is there discussion? Since the declaration was approved, we'll do a voice vote on this. If anyone wants to be recorded as no or present, please speak up after the vote. On the bill, Bill 24-1069 as amended, all those in favor say aye. Aye.
Aye.
Are there any opposed?
Present.
Councilmember Che will be marked present.